Aloha. This is Skye, your Soulful Progressive, formerly of FNN, now the Skye Soulful Progressive Show on Olelo and YouTube channel. Welcome, and tell your friends to like and subscribe so they can get that news every time, because I'm Hawaii's only African-American independent opinionated news reporter. Yeah. Now, what are we going to talk about today? Let me tell you. Now, what is it I'm going to talk to you about today? My new Substack, Matt and Skye, Hospital Horror Stories. We already have like 9-10 episodes, but my latest episode, I have talked to a 21-year professional in the healthcare care home facilities, and has been a worker and a CNA in these facilities for over 2 decades. Now, one of the things I noticed, because this is what Hospital Horror Stories is all about, let me give you a quick update. It's about a man that was put into forced hospice. Why? Let me tell you why. In 2020, Hawaii took on a new right to life law. And clearly, already in 2026, this law is being abused. Not by patients, not by caregivers, but by administration and doctors in facilities that you wouldn't think. Now, I already know of 2 to 3 wrongful deaths lawsuits in regards to this, because it seems like all of a sudden they're going to have a poor quality life and they need to be in hospice. And the person I'm talking about, when they took him out, they even tried to give him palliative care. They said he would never walk. He would never pee on his own. He would never breathe again on his own. You have to have the oxygen, they told him. They had no faith in him, no trust in the people that wanted to bring him home. But the 3 months he was in the hospital, he was constantly being forced and told by case manager, by doctor, by nurse, by RT, OT, respiratory therapy, rehabilitational therapy, you got to go in the nursing home. No, he doesn't. Uncle don't need to go nowhere but take his ass home. And they forcing it so much until I thought they are getting kickback. Somebody's getting something, or why would they force it? Why they had no faith? Now, I understand Hawaii is low on therapists and stuff, but they need to do better than what they doing. Because the level of care I saw them giving other people, they weren't giving to this person. Maybe because they wanted him to get in that care facility. Maybe they wanted all of his money. Maybe they wanted him to expire. Now, I'm going to let you take a listen to my latest episode of Hospital Horror Stories, so you can know for yourself what's really going on. Enjoy. Today we're going to get into this episode 9. We're jumping into the middle of the story. Matt has months to go, but today we're going to talk to a caregiving professional at a care home, because right away we notice that they're always telling Matt at this point to go to rehab, when really rehab was a long-term care facility. So now I turn that off. Now we're going to speak with a professional in the health care home industry. Angie, can welcome to the show.
Thank you for having me.
You're welcome. So can you tell us what is your professional background?
I am a certified nursing assistant in 2 states for 21 years.
All right. That is a professional, it sounds like to me. As a CNA, correct?
Right.
All right. And what we want to know and what our listeners want to know when it comes to care homes and caregiving, what should they know when it comes to uh, choosing or being in or uh, being at a hospital being told you should go to a rehab long-term care facility?
Well, I think it's really important that you educate yourself on, what your options are. A long-term care facility, with rehab, certain ones say they have rehab, but you really have to do your research to see if they can accommodate you. And I also think it's really important that you educate yourself on the financial aspect of, you know, any type of contract you'd be signing and entering, or agreement you'd be signing, entering into that. And I also think it's really important that you understand advocacy.
Okay, that sounds like a really good answer. And advocacy is important. That's why a nonprofit turned support group, Rare Disease Hawaii, is advocating now to create a space in regards to rare senior caregiving. So,
So that's great.
yeah, thanks. And to move on to the second question in regards to Saxman Matt, um, I hate to give the story away, but he's been uh, uh, at a home facility with a friend for more than a month and a week. And, um, well, in my care. And out of the hospital where he refused um, care. Now, when he was leaving the hospital, he was about 126, less than 130 pounds. Now he's up to 155, almost 160, and he's only been out a month.
That's
So,
great.
yeah, because he was in the hospital for from April, the second hospital from April the 13th through June the 1st. And at one period, he was like 110, 113 pounds.
Oh,
And
wow.
yeah, so he's flourishing. He's surviving on um, two levels of oxygen. We're still fighting to get a pulmonologist so we can try to get rid of the tanks, um, because he's really been doing his own respiratory rehab, which he got very little of in OT and RT, and they kept they they denied that to um, keep telling him to go into a rehab, saying he would get more of that in there. But we know that in our state, in Hawaii, uh, the jobs they're looking for more every day. They're low on uh, rehabilitation, uh, occupational therapy, respiratory therapy, and they can't even guarantee that he'll get respiratory therapy in these facilities. So, from the information uh, that's been told to you, medical information, how do you feel um, his recovery has been outside of the rehab?
Well, I believe that it's been remarkable. I think that really all a person needs to do is educate themselves based on what their health condition is and what's best for them. I mean, we live in a time where it's not hard to do that. And as long as you're, communicating with your with a healthcare professional, with your doctors, and I really don't see the problem. Also, that's a testament to how some people, actually recover quicker or better at home than they do in institutions, I believe.
I most definitely agree with you 100%. Having uh, the the care of of somebody that lovingly cares for you and your animals. He had shared pets, and that they are a big motivator. And now he's playing his flute. He was playing a samba the other day on his flute and was just pumping it hard. And afterwards, we checked the saturation rate, and it was still up there in low 90s. But every day on two, his saturation rate is 97, 98. So, like I said, the advocacy has to come in because we're still fighting to get the pulmonologist referral, which he should have had coming out the door when he was discharged, but they didn't. Um,
Mm-hmm.
yeah, somebody slipped up. I don't know if it was his doctor that was leaving him that referred him to a new doctor, or the doctors at the hospital that thought, well, because he won't go to rehab, we just aren't going to help him, and then he'll find out on his own. But he's still doing his. He has two little things that he plays with to exercise his breathing and his lungs. And we got him a nebulizer. They didn't want to fulfill the machine portion of the prescription because they said the doctor put the prescription together instead of separating them each. By the time the doctor came back from vacation and approved it, I had already had one ordered online, so it wasn't worth the trouble. And I think with that said, we have a right to life law here that I feel played part of the role of the forced hospice because it's being abused. And I feel like if they're trying to force him into a facility like that, they were going to force him into hospice again because one of the things they did refer to, which we did not want when he was discharged, was palliative care. Don't you feel that palliative care is just the next step to hospice?
Yes. Yeah, yes. I do.
Yeah, so do do you have facilities where you're from where the doctors and case managers kind of try to force them into a rehab or long-term care facility without the full understanding that it will not be short-term?
I do think that some healthcare professionals can be a little aggressive with their professional opinion. But that's why I feel like it's so important for people to understand advocating for themselves, because you always have a choice in your own health care. You know, you don't have to be forced to do anything that you don't agree with or believe in. I mean, you have a right to live, you have a right to recover the way that you choose, you have a right to die if that's your choice. You know, but to me, they're not saying that all
Heavy-handedness.
healthcare professionals are like this, but they're in a business to make money. You know, and referring you to these different facilities.
Yeah,
You know,
we were dealing with a lot of heavy-handedness, and right before he was dismissed, I
mm-hmm.
was given one last call by the doctor that lasted 45 minutes talking about, uh, you know, he's going to be right back in the emergency room. You
Mm-hmm.
know, he won't last outside a facility. You got to send him to a facility. And when I asked one of his doctors recently, I don't know if he got upset at me, but it seemed like he did because he walked away real quick. I said, because I asked because of the heavy handedness of the conversation, because I basically told the doctor after 40 minutes, I'm like, look, I wanted to get off the phone. I said, look,
Mm-hmm.
if he's got to learn the hard way, he'll learn the hard way. Okay? Let him go. That's what he wants.
Mm-hmm.
Let him go and let him find out. And
Right.
you find out. And it's like everybody is amazed. And he only has one doctor from the hospital. And that's the one I asked because, and I rarely saw him at the hospital because he would come super early, like 6 a.m. And yeah. But anyway, I would, or sometimes 5:30. I I asked him, I'm like, are these people getting kickbacks like a pharmaceutical check would from because you know I'm trying to understand why they're pushing it so hard. And I'm like, do they get he's like, that is against the law. And that is not allowed, and I would never do any. I'm like, not you. I'm talking about the ones that kept saying he needed to go to rehab.
Right.
I don't know anybody like that and walked off. So I may not be invited back to the next visit, or I'll just stay in the waiting room. But I had to ask somebody that question because it just seemed obvious with everybody pushing him in there, and now he's thriving now that he's out of there. You
Right.
know,
Well, you know,
he's
you knew what you were doing, and it's a good thing you did.
yeah, because he's walking the dogs, doing what he needs to do, taking care of his own self. Not laying in the bed depending on somebody to change him, help him walk. You know, his bed, he had a bed sore, it's totally gone. You know, and we didn't even go on a second visit to the wound care doctor. We didn't need it, but they sure did sucker us out of a lot of high copays for the cream that was supposed to have been a prescription. Now we're stuck with cream that had a $75 copay that we'll never use. Just had to mention that real quick. But so you really gave some really good insight on what's going on in regards to Matt's situation and the healthcare care home industry. Is there anything else you want to say before we end the conversation?
I would just like to, once again reiterate too. I also, wanted to speak about how a lot of the long-term healthcare facilities right now are understaffed. I believe that contributes to the lack of care that people could be getting in those facilities. I see a lot. I see a lot of people that work hard. I see a lot of people that are overworked and burnt out. I see a lot of management staff that don't really contribute a lot to the workloads and the burnt out effect that a lot of my coworkers have, meaning a lot of the nursing staff. Um, you know, I really believe that there's a lot of changes that need to be made in healthcare in general, but specifically within long-term healthcare facilities and rehab, there are a lot of things that are being overlooked. I've seen it in a facility, multiple times where, around the time when state comes, a lot of things in the facility begin to change. You know, bad facilities get shut down because they can't figure it out that quick, but there are mid-grade facilities that aren't necessarily bad, but not that great, that get by, when it comes to state. And then, they'll smooth over and do what they know needs to be done until state leaves, and then they go back to normal. But I will also say better communication through management staff and with other staff could be useful. I don't know what corporate uh, part of this is with being, so short staffed, but I really believe if we had, more staff, that it would be better. I notice a lot of facilities have done away with PRN like as needed. I don't know for what reason, but I feel like that, if you have more PRN people to fill in the blanks instead of overworking, full time people and then, losing them because of how you treat them. I think that more PRN staff could be real helpful. But those were just a few things that I wanted to mention that I have seen in healthcare.
Can I add something real quick?
Sure.
In the age of Trump, I know I don't know how much racism, discrimination, not healthcare cuts and Medicare cuts and the big ugly bill that was passed. But don't you think if we just put aside all the discrimination and the crap, shouldn't just America create a better culture to take care of its seniors? And if there was a better culture that kind of respected and cared for seniors more, maybe they would be taken care of a little bit better and people would want to do the jobs because corporations would also uh, be if corporations were forced to adhere to a culture of care towards seniors, because I'm quite sure in other countries they take care of the seniors maybe a little worse, a little less, maybe a little better. I don't know. But what do you feel about that?
I do agree, that the healthcare culture in general, needs to be changed. I I feel like that there are, that this is such a broad conversation that could go so many different ways, but I really believe that there should be more thought put into, what could be implemented and available, for not just elderly people, but there's also, disabled people that, need those type of facilities, and
True,
people that have injured themselves, old and young. And
true.
they need to put more thought into it, because I guarantee you, someone like me or you that isn't even a political official could, with enough time, could sit down and come up with quite a few bright ideas about, what could be done, and realistic ones at that, considering, you know, all of the responsibilities. I understand you can't just throw money at everything. The money has to come from somewhere. I get that, but if they, well, I don't want to get into that, but I feel like, the money could be found, that it could be used to initiate better programs, because I'm going to tell you, there's an extreme high percentage of people that are being misplaced and displaced within that system, as far as elderly people, veterans, disabled people. And don't get me started on foster care children that are transitioning into adulthood. There are not enough programs implemented to help fund these places for them to live. All of these people that I just mentioned, these groups of people, veterans, disabled,
Mm-hmm.
foster children transitioning into adult life, these people don't belong in long-term care. Look at the title, long-term health care. That is for people, in retirement age. That could be a good deal for them. Not saying they necessarily need the healthcare aspect of it, but there are some long-term care facilities that have residential homes, separate from the long-term care and rehab. So, and that's why I said earlier about, really educating yourself on your options, because
Mm-hmm.
it's a lot out there. But they don't belong in a place with elderly people. They belong in an environment that can be conducive to their healing, their recovery, or in growth. You know, that's why, like with Matt, he was able to thrive in the home environment. And I get that there are particular individuals that will not, because they need constant, round the clock care that possibly rarely could be given in the home, if they can afford to do that and they have the support to do that. But it can be difficult, but when you have someone that's low, they have a critical situation, but it's, low care, meaning they might not need round the clock care, they could thrive more in a home environment, but these are things that I feel like are overlooked, not looked at
Well, they got to
sometimes.
give more individual care.
Right, right.
Yeah, yeah, and you would think with people that have put their tax money into the system, they could at least get something back.
I agree with that.
All right. Yeah, and don't sign nothing until they read it all to you, not just tell you what the paper says. They should
Right.
read the paper. That's also,
Absolutely.
thanks for backing me on that one. So Angie, we appreciate it. We'll most definitely talk again, hopefully soon, and bring you back on the show. And is there any way anybody can contact you or anything like that?
I know.
All right. Well, stay free and stay anonymous. All right. Now, we appreciate your time today, and we want everybody to make sure they come back, listen again. If there's anything you like to help Matt out with, you can always go to Venmo, Skye Soulful Progressive, Skye spelled Skye. And this is Matt and Skye with Hospital Horror Stories, the Queen's Horror Story of Sex Man Matt leaving forced hospice and surviving to talk about it. And soon enough, we'll get to hear from him. So we'll continue on because we got more to say about the story. We have months to go. And on the next episode 10, we'll be talking about his time in Straub and how he survived that 2 months and the 2 setbacks he got and how we had to end up forcing a diagnosis for his lung condition that he suffered and made worse by being put in hospice, then denied proper care. We'll talk more. Thanks for listening. And that's what's really happening in Hawaii hospitals. Hawaii hospitals. And you think it's all good and gravy. Maybe if you're the special one, maybe if you're one of those that they care about, but some people, they just don't. And it's starting to show a little too much. Is it discriminatory over class and being poor? Hell yeah, it is. Hospitals don't like taking Medicaid and Medicare and all that. They want you to pay out of your AAA plus HMO plan because that copay is going to be thousands. You understand what I'm saying? Do you really understand? And if you do, leave your comments below. Give me your hospital horror story, and we'll make sure we'll get it out there. And if you don't like what you're listening to, don't listen to it. But if you do, leave your comments, boo. Or if you care to, that's Venmo at Skye Soulful Progressive. Thanks and mahalo in advance if you care to want to get me a cup of coffee or anything else, a drink. Yeah. Now, we got to remember, during this era of hate, we all got to participate so we don't let a law be abused by scrupulous doctors that bed hop from hospital to hospital, from state to state, killing everybody in their wake. Thanks for watching. Thanks for joining. More updates and more hospital horror story videos coming up. Peace.